Okay, so the next technique we're going to do is a technique or a mobilisation with movement with a belt to improve extension of the hip. So Glenn, how would we do this technique?
Okay, so we've got a chair in place here. One thing to be cautious of is people's balance, so they're going to be standing on one leg, so I often use a chair with a back like that so they can place their hand on the chair if necessary. We're going to work on the right leg, so I'm going to get Patrick to place his left foot up on the chair, and then if you can put the towel as high up into your right thigh as possible. Again, make sure everything's out of the way, and then I'm going to put the belt around. So with this technique, we want to have the belt as high up as we comfortably can be. I'm going to stabilise his pelvis with my left and right hand on the front and back of his pelvis, and then I'm going to just sit back with my body weight to create a lateral glide, and then I'm going to ask Patrick to lean forwards, and I'm going to follow him as he does that. So we're creating a lateral glide with hip extension.
And handling wise, where are your hands in terms of on the pelvis, or is it just kind of stabilising around that?
Stabilising around the pelvis, so the front of my hand is wrapping around the front of the iliac crest, and the back of my hand is just into that gluteal region. I'm not really pushing, I'm just bracing. Yeah, so if I'm not doing that, you'll see that I'll pull Patrick to the side. Yeah, so because I'm going to create a lateral glide with my body, I need to counterbalance that with my hands essentially, but I'm not pressing forwards. Yeah, I'm just kind of having my elbows nice and tight into my body, creating a little bit of support, and then that gives me a counterweight as I push back with my body. And it's really important that you have your body square onto them. I see a lot of people doing it in this kind of position and then they lose that glide. So I'm nice and square on, and I'm anticipating that I'm going to move forwards with him. So there's no point in me being here and then it changes to more of an AP glide, doesn't it? So you have to be positioned right, knowing that I'm going to move as he moves as well.
Yeah. Perfect.
So yeah, that's a mobilisation with movement in a functional position for hip extension.